Hello, everyone. Welcome back to Dr. Heather ND, and welcome to my new 5-Minute Facts series. Today, I'll be talking about traditional Chinese medicine herbs and herbal energetics. So, what are herbs? This may sound like an obvious question, but many people don't realize that herbs in TCM aren't only plant parts like leaves, roots, or flowers, but also animals and minerals as well. I've listed a few examples on the slide. We have ginger, ginseng, and licorice as plants, gypsum, oyster shell, and mirabilite as minerals, and donkey hide gelatin, turtle shell, and earthworm as animals and insects. But there are literally thousands of herbs in the Chinese Materia Medica, so this is just a very small sampling. So how can these plants, minerals, and animals, aka herbs, be used? Either as single herbs, which just means an herb by itself, or as formulas, which are blends of herbs combined to treat certain disease patterns. Herbs are most commonly used internally, but they can also have external uses. They're used short-term, long-term, or anywhere in between. So you might take a formula for a day, maybe for weeks, maybe for months. It just depends on the condition and the person being treated. Herbal medicine can be used on its own or combined with other interventions or treatments, such as acupuncture, moxibustion or cupping, diet or lifestyle change, etc. And very important to note is that herbs are used to treat TCM patterns, not Western or biomedical diagnoses. So if someone has, say, rheumatoid arthritis, there's no single formula that we'll always use for this condition. Instead, we look at the pattern or patterns present in the case and begin to make our herbal selections from there. What about herbal preparation? The two most common forms of herbs are granules and raw herbs, which are made into decoctions kind of like how you'd make a tea. While granules might look just like a coarsely powdered herb, like what's pictured on the slide, they're actually concentrated herb, so much so that 1 gram of granule actually equals about 5 grams of raw herb in terms of strength. Pills or powders can be used for internal use, or oils, salves, and liniments for topical use. And then there are other ways of preparing herbs as well, such as charring or frying. Frying can be done dry or with a liquid, such as honey, wine, vinegar, or ginger juice. And different preparation methods will somewhat change the quality of an herb. For example, if you fry with honey, that will help an herb to be more nourishing and moistening. Frying with wine will help unblock the channels so herbs gain more complete access. Charring will stop bleeding, etc. Herbs are chosen, again, according to disease pattern, and I've listed a few examples of TCM patterns here. We have kidney yang deficiency, liver qi stagnation, damp heat in the gallbladder, spleen qi deficiency, etc. Herbs are also chosen according to temperature. Herbs themselves have an energetic temperature ranging on the spectrum from hot to cold, and this becomes important when we're treating certain imbalances of yin and yang in the body, and I'll explain more in a minute with an example. And herbs are chosen according to the acupuncture channels they enter, and I've listed the 12 main channels here on the slide. So we have heart, lung, liver, spleen, stomach, gallbladder, kidney, urinary bladder, small intestine and large intestine, pericardium, and sanjiao. Note that all 3 points on this slide are related, and what I mean is, for example, in kidney yang deficiency, there will be an element of cold or cool, because in Chinese medicine, we consider yang hot and yin cold. So we'd want to use warm or hot herbs in this case, and we'd have the kidney channel at least involved. So a disease pattern typically encompasses a temperature quality and certain channels, and we choose the most appropriate herbs for that pattern accordingly. And finally, can herbs be combined with other medications? When a patient says, I'm taking pharmaceuticals and/or over-the-counters, can I also take Chinese herbs? The answer is, it depends. All good medicine is individualized, and we have to look at the drugs being taken, the Chinese herbs indicated, and then whether they're appropriate to take in combination. But most Chinese herbs can be taken with other medications. There are exceptions, and I've listed some of the most common contraindications here, such as when a patient is taking blood thinners or is pregnant or nursing, or when an herb and drug both have the same effect. For example, if both an herb and a drug lower blood pressure, then if a person takes both, their blood pressure may come down too far. So as I wrap up, I just want to point out that the info here is just a tiny drop in the bucket of Chinese herbalism, which is a tradition with thousands of years of history. But hopefully you come away with at least a little better understanding of the foundations of Chinese herbs and herbal energetics. Thank you for watching, and we'll see you next time on Dr. Heather, ND.